Hello and welcome to this video on how an injury as innocuous as a paper cut can kill. This whole video was inspired by an article we saw several years ago, wherein a French doctor travelling internationally to provide medical aid, while travelling, experienced a small paper cut, as anyone who has ever handled paper can attest to. The difference is that they died, and how they died soon after returning to France. They were unwell on the return flight, became progressively worse, and eventually hospitalized, then dead. All from what is often thought of as just as mundane, but thankfully short-lived painful event. Paper cuts are a great example of how the body's first line of defense to pathogens is breached. In this case, you literally cut through the skin. Skin secretions, like sweat, sebum, and mucus, and thereby expose the connective tissue at best and all the way into capillary beds at worst. This is like an open door to disease. Now, if you clean the injury, cover it with a band-aid, and are in otherwise good health, you have no real problems normally. Normally being key. If you are not in good health, such as being immunocompromised, having comorbidities, or one of many other ways the immune system is weakened, it can end badly. Another option is if you are exposed to a particularly nasty pathogen, such as rare or tropical diseases, medication-resistant strains of fungi, bacteria, or viruses, and more again. You could also just be in a bad place where thorough medical care and treatment is hard to get. For example, a few years ago, rabies vaccines were in very short supply, so depending on if you got bitten while traveling, you might have to travel to another country to be vaccinated. The worst case is if you get a combination of everything mentioned. With all of that in mind and having been said, let's start by breaking it down to the simplest case. That is, a breach of your protective barrier called the skin. The skin is a physical barrier. It exists to act as a wall that keeps you inside and the world outside at its simplest. To make it easier, the skin secretes sebum, sweat, mucus, and antibodies. The sebum is a mildly acidic substance, as just about all oils are, a phenomenon you can test for yourself with litmus strips and a particularly oily patch of skin. The mild acid makes the skin less hospitable for many species of bacteria and fungi. That assists in keeping the population in check so that they can't establish a colony and begin to cause damage. Sweat is much more direct in how it works. It forces bacteria and debris out of pores in your skin. It also washes them away from the skin surface as a whole. It rinses your skin. This reduces the population of bacteria and fungi even further. Also, the sweat itself is full of salt and other metabolites from the local cells. These can also make it even less hospitable to bacteria and fungi. The mucus is full of antibodies and acts as a sort of a tar trap. Bacteria, fungi, and more get stuck in it at a microscopic level, and they either die or get removed via other mechanisms such as sweating or sebum. The last are the antibodies. These help by sticking to pathogens and making it harder for them to do anything. They also act as a sort of flag telling the immune system, "This is dangerous, get rid of it." Collectively, this is a very efficient system and very effective. That is demonstrated by the fact that most of the time, the worst you need to worry about is pimples, and not flesh-eating bacteria devouring your body from the outside in. That is, unless you breach the skin. That is, a cut through the body's defenses. This bypasses the skin, sebum, sweat, mucus, and antibodies on the skin surface. If you are healthy, you might get a short-lived local infection, but it will be contained, and reasonably so. You may not even really notice it at all if handled well. However, it will provide the necessary opening to bypass each individual component being effectively and completely bypassed simply by cutting through the skin. Now, what if you're not healthy? For this, we can focus on generic immunodeficiencies. We're not going to focus on any specific case study, but it could be something like a lack of leukocytes, dysfunctional production of certain leukocytes, or a much more significant delay in getting an immunological response. No matter which, it leads to the simple series of following events, at least in very broad strokes. First, the normal backup of body defenses, called the innate system, is largely missing. These are the cells that are always floating around in blood waiting for a signal to take action. Once they get the immunological equivalent to the bat signal, they jump into action. Neutrophils undergo netosis to capture bacteria and fill the injury with a sort of net. The platelets help to bind with the product of netosis and themselves to form clots. This seals the injury site. Macrophages phagocytize bacteria and carry them away to dendritic cells. Inflammation blocks the flow of blood out of the injury site and increases blood flow in. The area swells from edema and more leukocytes are delivered. The cells start to send out cytokines, among others, to signal damage. All of these help to do two things. The first is ramp up production of innate leukocytes. This will fill in and help to hold the breach, so to say, until the third line of defense or the adaptive immune system can kick in. The second is the adaptive immune system. This is what will make B cells, which in turn produce antibodies specific to the pathogen that got through the breach in your skin. B cells will take time and need to be given antigens from the dendritic cells to know what their target is. Without this, they cannot do their job. Further, T cells will be made. These have a role in directly attacking the pathogens. Some are specialized for bacteria, others viruses, parasites, or fungi. That specialization makes them better at the job, but they need time to rally. This is the problem with those who are immunocompromised. They could have issues with the monocytes. No monocytes means no way for dendritic cells to get the antigen samples. That cuts off the antigen response at a relatively early stage and makes it much slower. This also stops some of the early inflammatory responses, or perhaps it would be better to say the positive feedback for those early responses. That blocks your body from as effectively curtailing the spread of the pathogen. This increases the risk of an infection establishing itself, or worse yet, becoming sepsis. Then we have the B cells. No B cells means you'll have far less effective immune response, as the B cell antibodies are like flags on the pathogen. It screams, "Attack here." T cells are perhaps the worst scenario. They are important in directly attacking the pathogen. If they are not active, you lost the major arm of the immune system that deals with pathogens in terms of the adaptive immune system, or the one specialized in dealing with them. This forces you to rely on the innate immune system. The innate immune system relies on cells like monocytes, which may also be handicapped. Without an increase in monocyte activity, you don't get the necessary cell signals to increase all of those leukocytes in production phase. That means you have even fewer of those cells to deal with them, and what those that you do have are being tied up dealing with the infection. Next, we have available facilities. For the most part, you can get away with washing a basic injury like a paper cut with soap and water. Ideally, you would use a cleaning solution, but it's not necessary. However, you do want to cover it. That prevents dirt and debris from getting into the injury. Soap and water will minimize the possibility of a pathogen getting through your skin, and if they do, the number is so small the immune system can deal with it before the adaptive immune system fully mobilizes. Just in case, and more so in medical settings, a cleaning agent like alcohol or similar, while hurting like a bitch, will kill most if not just about all pathogens and remove the need for any worry. What if you don't have access to such things? Or worse yet, have only access to water of unknown provenance? That is, what if the water itself is contaminated with pathogens such as cholera, salmonella, E. coli, and more? That is more likely in underdeveloped regions, and as harsh as it may be to say, there is a much higher probability that there may be fecal contamination of water in those areas. Not just will they be more likely to have a lack of facilities, but unfortunately more likely to have water of worse quality and is more likely to be contaminated. Using this to clean a paper cut can lead to infection, as you are adding new and possibly, if not likely, more resilient bacteria to the injury. That's going to completely undo any point in washing it and likely have exactly the opposite effect of ensuring infection. The catch to this is if you are exposed to resistant strains of bacteria, fungi, viruses, parasites, and so on, that is one of those strains that are resistant to medications intended to get rid of them. They tend to also be more pathogenic, that being a fancy way of saying they create more serious symptoms and are harder to treat. The genes that confer resistance to medication nearly always have an association with resilience and generally have a relationship to increased generation of infection ability. This also leads to being much harder to treat altogether. You have more of the pathogen, it's harder to kill off, and it tends to cause more serious symptoms. When you have all of these combined, you effectively have a worse condition, more aggressive pathogen, more likely to be exclusively pathogenic and resistant to conventional antibiotics, which means you are in a very bad place, especially if by virtue of washing it with contaminated water, you've just put a large population into that injury, which is like giving them a feast and telling them to colonize this new place with all the resources they could possibly need being provided. This leads to the issue of treatments. As with the French doctor, this meant they had to use a very powerful and last line of antibiotics. These are antibiotics that are at high doses because the high doses are needed for an advanced case of sepsis and generally for resistant strains of bacteria. When you use these antibiotics, they can cause things like kidney failure, heart failure, liver damage, and more. This is a result of how the body metabolizes the antibiotics, and some of the metabolites made are particularly toxic. But it's a choice between carefully monitoring how the body is and killing off the resistant bacteria, parasite, fungi, or whatever it happens to be. These drugs are also generally only available in larger hospitals, where you have the appropriate facilities, and these are available for the patient. The justification exists for holding these otherwise more rare and exotic medications. The staff are knowledgeable about the use of them, and they will see cause to use them at least somewhat regularly, as patients who require that medication will be transferred. In the end, a paper cut is unlikely to ever turn into anything deadly for the vast majority of people. It does require that a number of key events line up without which the immunological system within the body, or basic frontline antibiotics and care, will be more than enough. If the problems start to line up, then your circumstances start to look more dire, as each requirement slots into place, with the most extreme outcomes requiring the most successful alignment of all possible events in the worst possible way. Thank you for watching this video. If you found it interesting, consider liking, sharing, and subscribing. Please post any comments, questions, or suggestions you have below.